Hey everyone, Dr. Mike here, and today we're diving into a serious topic: cardiac arrest. It's a life-threatening condition that can strike anyone, anywhere, at any time. And trust me, as a doctor, it's something I never take lightly. Now you might be thinking, Dr. Mike, this is scary stuff. And you're right, it can be. But knowledge is power, and understanding cardiac arrest, what causes it, what signs to look out for, and how to potentially prevent it, can make a world of difference. So whether you're watching this for yourself, a loved one, or just to be more informed, stick around. We're going to break it all down in a way that's easy to understand, so you can feel empowered and ready to act if you ever need to. Let's get started. All right, let's talk about what actually causes cardiac arrest. Now, the first thing to understand is that it's different from a heart attack. In a heart attack, blood flow to the heart is blocked. But in cardiac arrest, the heart's electrical system malfunctions. Imagine your heart's electrical system like the wiring in your house. If there's a short circuit or a power surge, things go haywire, right? That's similar to what happens in cardiac arrest. The electrical signals that control your heartbeat get disrupted, causing it to beat erratically or even stop altogether. So, what can cause these electrical malfunctions? Well, one of the most common culprits is heart disease. When your arteries are clogged with plaque, it restricts blood flow to your heart, putting extra stress on it and increasing the risk of electrical problems. But it's not just heart disease we need to be mindful of. Certain medications, electrolyte imbalances, and even some genetic conditions can also disrupt your heart's rhythm and lead to cardiac arrest. And we can't forget about lifestyle factors. Smoking, excessive alcohol consumption, drug use, these can all damage your heart and increase your risk. Now, I know this might sound overwhelming, but remember, knowledge is power. By understanding these causes, we can start taking steps to protect our heart health. Recognizing the signs of cardiac arrest is crucial. Time is of the essence, and every second counts. So let's talk about what to look out for. The most telling sign is a sudden collapse. Imagine someone going from perfectly fine 1 minute to collapsing the next. Now, not every collapse is cardiac arrest, but it's always a cause for concern and immediate action. Next, check for a pulse. If you're trained in CPR, you know where to check, either at the carotid artery in the neck or the radial artery in the wrist. If there's no pulse, that's a major red flag. Along with no pulse, someone experiencing cardiac arrest will also stop breathing. Their chest won't be rising and falling like it normally would. Other signs to watch for include sudden loss of consciousness, no response to touch or sound, and a bluish tint to the skin, especially around the lips and fingertips. Remember, these symptoms typically appear suddenly and without warning. If you see someone experiencing any of these, call 911 immediately. Don't wait, don't hesitate. Every second counts. Now that we've covered the causes and symptoms of cardiac arrest, let's shift our focus to prevention. Because the truth is, many cases of cardiac arrest can be prevented with some simple yet powerful lifestyle changes. First and foremost, prioritize your heart health. That means eating a balanced diet that's low in saturated and trans fats, getting regular exercise, maintaining a healthy weight, and managing stress effectively. Next, if you smoke, quit. I know it's easier said than done, but trust me, your heart will thank you. Smoking damages your blood vessels, increases your blood pressure, and makes your heart work harder. It's also crucial to manage any underlying health conditions, like high blood pressure, high cholesterol, or diabetes. These conditions can all increase your risk of heart disease, which, as we discussed, is a major risk factor for cardiac arrest. Regular checkups with your doctor are essential too. They can monitor your heart health, identify any potential problems early on, and help you make informed decisions about your health. And finally, consider learning CPR. CPR is a life-saving technique that can help keep someone alive until professional help arrives. You never know when you might need to use it. It could be a loved one, a stranger, or even yourself. So there you have it, a crash course on cardiac arrest. Remember, this condition is serious, but by understanding its causes, recognizing the warning signs, and taking steps to prevent it, we can significantly reduce our risk and potentially save lives. I encourage you to share this video with your friends, family, and everyone you know. The more people are aware of cardiac arrest, the better equipped we'll be to respond quickly and effectively in an emergency. And as always, if you have any concerns about your heart health, please don't hesitate to reach out to a healthcare professional. They're your best resource for personalized advice and guidance. Stay safe, stay healthy, and take care of your heart.